Hi, my name is Dr. Melissa Carr, and I'm a doctor of traditional Chinese medicine in Vancouver, British Columbia, Canada. I thought today I would do a little short demonstration of how to do acupressure. So many of my patients right now, I'm sending home advice with the COVID-19 pandemic. I'm unable to see them at home, and so I'm giving recommendations of things that they can do on their own at home. And one of the things is acupressure, so I can send a list of acupressure points that would be suitable. And I thought I would show you how you do acupressure. So acupressure is a mild stimulation of the acupuncture points. You can make it stronger by applying more pressure or more concentrated pressure to the points. But it is something that you can do at home, either using your fingers. You can use your thumbs if you want a little stronger therapy, especially on larger muscle areas. You might use a pen cap or even a crochet needle, something with that's thin enough, but not pokey, not pointy. So I'm just going to demonstrate a little bit about how to do it. So depending on where you're doing the acupressure point, you're going to want to apply pressure for anywhere between 10 to 60 seconds and some of them are center line, so you have one point that you're going to do, and some of them are bilateral, both sides. So you can apply to one side and then the other. For example, if you're doing it on your hand, your arms, or for your legs, you can do them both at the same time. So I'll just demonstrate one point here that's easy to show on the hand. So I'll show you on this hand here. I'm going to apply the common acupressure point of large intestine 4. So once you know the location of where you're going to be applying the point, so in this one I'll show you because this is a common point to do. It's really good for headaches, jaw pain, TMJ syndrome, jaw tension, temporomandibular joint pain, mouth or tooth pain, frontal headaches in particular, eye pain, or sinus pressure, those kinds of things it can be helpful for. And it's also a large intestine point, so it can be helpful in some cases for digestive issues as well. It can help with other kinds of body pain too. So one way to locate it is to use the crease of your thumb of the one hand, and then you're going to look for the edge of the web of your other hand. So I will have those two meet and then roll till you hit the tip of the thumb, and that's going to meet the muscle. In this case, it's the muscle between your index finger and your thumb. And one way to know that you've hit the right spot is it's a little bit tender. So you're going to apply a little bit of pressure. It's going to feel a little bit sore. If you haven't found the sore spot, then move it around a little bit till you find that. So with some of the points, they'll be quite obvious and others less so. And if you find it, you try it on one hand, try it on the other hand, see maybe you have a different level of tenderness with it. Maybe one side's more tender than the other. So when you apply the pressure, you can apply with just a simple squeeze, just press the point. And I do recommend, especially if you are doing acupressure somewhere on somebody else, that you start off with the pressure light. So say, for example, you're going to do the tops of the shoulders. You're going to start off with a light pressure and then gradually increase the pressure and ask the person that you're working on, how is the pressure? It's easier to gradually increase the level of pressure that you apply rather than go full force, too strong, too fast, and cause somebody pain. So you're going to start off light and then gradually squeeze a little bit more until you find the right level of soreness. That means it's a little bit sore, but it's not like you're going to be bruising yourself. You're not gritting your teeth against it. You just feel it's a little bit tender. You can also do little circular movements if you like with it. That's another way to apply pressure. You can also do a pulsing with it if you want. Okay, so acupressure, very easy to do once you find the acupuncture points. Another tip about the acupuncture point location, I'll show you another one here, lung 7, because this is a fun one to show. So if you put your hands out like L's here, you're going to have the two meet here. and then just twist until your hand, I'll pull my sleeve up here, till your hand, your fingertip touches the top of the bone here, okay? And when you find that spot here, you're gonna find the spot right in the top of the lower part of the arm towards the wrist here. You're gonna find a little spot that is in a little bit of a divot. So acupuncture points are almost always found in a little divot, a little area of a tiny little hole, a little space. It's not directly on a raised point. There are some directions of some acupressure points. This point, that was lung 7, by the way. This one was large intestine 4. Next point I'll show you, which is a different way to locate. We might have a little bit of a, so you've got the bone. You can see when I've got my wrist like this. When I got my wrist like this, you can see the bone that's raised up there. I'm going to put my finger at the tip of that. And then when I rotate my arm, that actually disappears. So that's the way to find that small intestine point, is I'll have somebody put their hand palm down, touch the tip of the bone with their other hand, with the finger, rotate, palm up, or this way, and you'll find that you've got the spot right there. It's actually what was previously protruding is now not. And so again, I'm in a divot. Another way that I'm going to locate acupuncture points is, we call them cun. Those are measurement points in acupuncture. A cun, spelled C-U-N, is a Chinese measurement of the acupuncture location. So 1 cun is basically the top part of the thumb. So the last section of your thumb. That's 1 cun measurement. So if I wanted to measure 1 cun out from something, that is one way that I can do it. Sometimes we say finger width. So you would just use your usually index finger as a finger width away from an edge or another location of a bony protuberance, an area where you can feel, for example. That might be another description of finger width. 1 cun, 2 cun is 3 finger widths. So what a common point for 3 cun location is pericardium 6. This point is for nausea. So you're going to find the wrist crease where your wrist bends. You're going to go 3 cun down, and the point is actually in between the tendons here. Okay, so I'm going to find the tendons, and it's 2 cun down from that. Okay, so that's a 2 cun measurement. A 3 cun measurement is the width of your hand. So your 4 fingers at this level here, okay? That would be, for example, there's a point on the lower leg that you can do. Stomach 36 is 3 cun measurement down from a spot that you find on your knee. That's a 3 cun measurement. So 1 cun, 2 cun, like that, and 3 cun, that. Recognizing if you're doing this acupressure on somebody else, if you're applying pressure on somebody else, you kind of have to, you can either take, if you're a different size than that other person, then you would want to either take their hand and get a measurement of their hand in comparison to yours. If you're using your hand to measure on somebody else, you can take their hand and measure out their distance. Their 1 cun, 2 cun, 3 cun is going to be different than yours, perhaps, if they're a different size than you. So as TCM doctors, as acupuncturists, we get to get good at being able to locate the points. We're not grabbing people's hands and checking, but we judge based off of their size, and then we have practice and time to be able to feel for the acupuncture points in a different way. But if you're new to it, you do need to use some measurement skills. If you have any questions, feel free to let me know. That's the basic way to do some acupressure, basic way to find an acupuncture point. And I hope you have a wonderful day. Again, my name is Dr. Melissa Carr. I am a doctor of traditional Chinese medicine in Vancouver, BC, Canada. And my website is activetcm.com. Thank you very much.